I'm here today with GainsWave provider, Dr. Nicole Eisenbrown in Florida. Dr. Eisenbrown, thank you for joining us today. And if we can start off by telling us about your specialty and your practice, please.
Sure. Well, first of all, it's my pleasure. Thank you for inviting me. And I am a urologist. I've been a urologist for 20 years. I'm actually board certified in both urology and female pelvic medicine and reconstructive surgery, but I retired from traditional private practice about a little over a year ago. And I moved to Orlando, where I am now, and I have kind of a concierge practice where I only offer non-surgical treatments for erectile dysfunction and Peyronie's disease.
Thank you, doctor. And how was that transition from an insurance-based urology practice to a concierge-style private pay practice?
Actually, it was really pretty easy, and I'll be honest with you, I don't miss insurance hassles a bit. We don't deal with insurance at all. It's all patients pay with credit card or care credit or cash, whatever it is that they prefer to do.
That's great. And how did you hear about GainsWave originally, doctor?
You know, it's interesting. I was thinking about that. I think that I first learned about that after I learned about the P-Shot. And I was on a webinar about using PRP, and someone talked about GainsWave and was very complimentary of how well it worked together. So I started doing my research, and then I stumbled upon you.
Thank you. And how long has it been part of your practice since you opened, I guess?
I opened April of last year, so it's just a little over a year I've been doing this.
And what features of the GainsWave program do you find most valuable?
Well, there's lots of things I like about the GainsWave program, but I would say probably if I had to name one, it is the number of leads that I get just by being on your website. You know, we didn't do any advertising when I first opened, and I didn't have a practice to market to because I had moved to a completely new town, and I had clients right from the time I opened my doors. I get a lot of really good, high-quality leads just by being on your site.
And on the subject of those patients, how have your patients responded to the GainsWave treatment? Good outcomes, I hope?
Yeah, we've had some really great outcomes. I know that the GainsWave data says about 85% of people have, you know, meaningful response, and I would say my patients have at least that. You know, I think it does depend a little bit on patient selection, and I'm learning more about that as I go on. You know, the people that respond the best are people who are getting erections, but maybe they don't last as long. They kind of lose it, or they respond to Viagra, but Viagra doesn't work as well as it used to. Those people respond very well. I have a harder time with the people that aren't getting any erections at all, and it's probably because they're too far down the line at that point.
Got it. Is there a specific GainsWave patient story that stands out to you?
Yeah, actually I have several, but one of my favorites is a gentleman that, he was one of my first clients. He came to me, he's 72 years old, has been married for over 30 years. He takes good care of himself. You know, he's exercises, eats well, all that sort of stuff, but he was having trouble in the bedroom. And his wife even said to him, you know, honey, I think, you know, we've had kind of a good ride, but maybe we should just accept that this is no longer going to be a part of our relationship. And he didn't want to accept that as an answer. So he came to see me, and he did the enhanced program, and his shim score went up 10 points. And he wrote me a full-page letter. He was so happy, and that was a year ago, and he came back for a 6-month maintenance, and I just saw him actually today. He's doing some more maintenance, but he's very, very happy with his response. And he told me after the 3rd treatment, his wife was starting to initiate sex again, which she had not done for a long time. So
that's amazing, fantastic story. And what would you tell a fellow doctor who's considering adding GainsWave to his or her practice?
I think it's pretty much a no-brainer. The overhead to get into this is very low, and the need is huge. I find that men take their erections very, very seriously, and they're willing to spend money on it. I would hands down recommend anybody consider doing it. And anybody's welcome to call me. You please feel free to give people my contact information if they want to talk to somebody who's been doing it. I've been very successful with it. And like I said, I don't even have a practice to market to because I retired from it, and it's done very well for me.